Welcome back. President Trump remains in Walter Reed Medical Center this morning as he battles COVID-19. Joining us live now to talk more about the president's positive test is Dr. Rob Danoff of Jefferson Health. Morning, Dr. Rob.
Morning, Jim. How you doing?
Doing very well, sir. So we know the president has been given supplemental oxygen as well as remdesivir and dexamethasone. What can you tell us about these treatments?
You know, these are very aggressive treatments. So in other words, the first treatment he received were these called monoclonal antibodies, and this is something that is experimental. So it's enrolled 250 people throughout the country. And what it does, this was on Friday, it helps build up the antibodies. So it hopefully decreases the symptoms a person has and decrease the length of time they have symptoms. And that was given first, and it's called compassionate use. So the president must have been having some significant symptoms on Friday with perhaps fever and needing some oxygen. Then remdesivir, we use that when a person's hospitalized and to try to decrease, again, the symptoms and the length of time that they're sick. And now, of course, using the dexamethasone, that's a steroid. Normally, we only use that when a person is either on a ventilator or requires oxygen. So what it tells us is that perhaps the president had more significant symptoms than they initially let on.
Well, we kept on getting conflicting reports from the doctor and the press folks over the weekend. So many experts say he's not in the clear just yet and that sometimes the second week can pose issues. So what could we be looking for over the next few days with the president?
You know, that's a good point. So certainly over the first 7 to 10 days with a person who has symptoms or has COVID-19, you know, it's unpredictable. So we don't know, you know, a person could be chugging along doing fine with their oxygen levels and then all of a sudden go off a cliff and decrease. So they're really going to have to keep a close watch, which they are doing. And that's probably why he was given the steroid, because they want to watch his oxygen levels, make sure he's oxygenating okay. But, you know, so he's not in the clear yet. And he has great care, and certainly what they have given him is aggressive treatment to try to maximize the ability to fight off this infection. And in seniors, anyone over 65, certainly, those are most at risk. And what happens is fatigue, trouble thinking, trouble breathing, you know, these fevers, those are things that they're going to be really watching out for. And then lastly, they're going to have to watch, they're going to be checking to see about, it's called D-dimer, his clotting. Sometimes we have to add a blood thinner. So they're really going to be watching very carefully is what they're doing now. And I'd be quite surprised if he goes home, you know, to the White House today. It's very surprising, given that he's still on remdesivir and he still needs a few more days of treatment.
Well, Dr. Rob, a lot of people are talking also about the president's drive-by outside the hospital and the potential danger for those people in the vehicle. So what do you make of that move? I mean, he's still infectious at this point, isn't he?
He's very infectious. You know, a person is infectious 48 hours before symptoms and then 7 to 10 days afterwards. Anybody in that vehicle, anybody, the Secret Service, the driver, will now have to be quarantined for 14 days. Anybody in that vehicle, because it's hermetically sealed. It's a very tight environment. Nothing can get in there, air. So it was quite surprising because he's infectious, unfortunately. And so it was just surprising that he, one, went out of the hospital, and two, people were in a closed environment in that car with the president.
So, Dr. Rob, 2 U.S. senators have also now tested positive in the past few days. You were speaking about age. There's no testing protocols on Capitol Hill. Does that surprise you, particularly since we have senators in their mid-80s?
It's really surprising. They're not following science. They're not following what the public is needing to do, you know, what the hospitals are needing to do, you know, what schools and nursing homes are needed to do. You know, you speak about nursing homes, the average senator, there's a lot of senators over age 65 and Congress people. So they really should have regular testing protocols. But what is more surprising in the White House, face coverings and distancing are optional. Optional. It shouldn't be optional. Everyone there should be wearing a face covering, a mask, because testing alone does not take care of it. And the tests that they use, they have to do frequently because the tests aren't that accurate. Those rapid tests, they're good, but you have to do them frequently. But you still have to do social distancing, and you should wear a facial covering. I hope the White House changes so everyone protects everybody, including the president, so they have facial covering.
Christie also admitted himself into the hospital after testing positive. He has a history of asthma. He's significantly overweight as well. Why do people with those sorts of medical issues have to be especially careful?
Yeah, because their lungs are compromised, or males are at higher risk than females for significant serious illness from COVID-19. Being overweight adds a risk factor. Respiratory disease or heart disease adds risk factors. COVID-19 attacks a lot of systems, potentially. Your lungs, your heart, your liver, your kidneys. What it can do if it gets serious with people is just unbelievable. That's why we have to really watch carefully, especially people who are older, who are male, who are overweight. Those add risk to their body to fight off this infection.
Well, good advice as always, Dr. Rob. We appreciate it. You continue to take care of yourself, and we'll check in with you from time to time.